Good evening. Do we want to start off with our traditional introductions for everybody?
Of course.
Rachel Vassalero, Challenger K-8. This is my second year. I don't know. Where are we doing? Hi.
How about title?
ESE
what you do.
Inclusion. ESE Inclusion teacher.
Thank you.
Andrea Kelleher, Parrott Middle School, 8th grade language arts.
Dana Blazik, J.D. Floyd, IPC.
Lisa Maserio, HCTA president. Just to clarify, this is really only still the end of the first week of school, right? It's day 5, so, you know, everybody's getting used to.
It's Tuesday start day. So I'm going to talk to that later.
Patricia Greenwood, CHS, self-contained ESE. It's been a long week already. Treasurer for HCTA.
Casey Tobias, Suncoast Kindergarten.
Stacy Donahue, J.D. Floyd, ESE Inclusion Teacher.
Joyce McIntyre, CFO. Angelina Lamantia, Financial Analyst. Alexis Brown, Director of Human Resources.
Barbara Kidder, Assistant Superintendent for Business and Support.
Matthew Goldrick, Director of Labor Relations and Professional Standards.
Steve Canale, Executive Director, Support Operations.
Lisa Braithwaite, Principal, Explorer K-8.
Mike Lastra, Principal, Eastside Academy. Remember, I say that. I gotta say that now.
I know we met a lot in July, but that seems like years ago. So.
When Mike was like, it's only Mr. Ushers, and it's only day 5. I was like, day 5? Sure it's not 10? 20?
So did you guys have something you wanted to start with today?
No, I'm pretty sure that at our last meeting, our proposal was the last one that was passed.
Okay. Because I was kind of working out the idea that in the end, I think we proposed back that we could do, I can't remember how it happened, but we settled on what we settled on.
Yes.
And so I was anticipating you guys maybe making something, but I thought what might be appropriate, if it's okay with you, is to talk about health insurance, because
Definitely.
some of you were at the insurance committee meeting, and so I prepared a handout just so we could review some history. Thank you. And you'll see it has the year, it has the board contribution. There was a period of time where the individual plan had a small contribution from the MLR and profit sharing. That's what that third or fourth column is. And then the employee contribution per pay period. So you can see, one thing I wanted to talk about was some trends on that. Because you see where back in 2020, the board contribution was 275.36, and I think it was that way for a while. And then it was that way till 2022. And then since 2022, it's gone up each year to cover that insurance increase, so that now we're paying the $421.83 per pay period. And just, these are not exact numbers, but just for some numbers to compare, you know, if you figure 2,200 people, that's 14 million compared to 22 million. So we've gone from where it was 14 million to cover that 275 per pay period up to 22 million to cover the 421 pay period. That's not exact, because the 14 and 22 are decreased in terms of how they impact the general fund based on whatever people are paid for from millage or grants. So we're able to budget less than that and pay less than that from the general fund, which is usually what we end up talking about at this table. The other point I wanted to make about it, which I think is worth noting, is that due to the way this has been done in the employee contribution, and I think that 22 through 22 were relatively good years in terms of increases because of claims rates. Those the employee deduction per pay period has not gone up. In fact, if you didn't take the 60, it's actually gone down slowly because we always put the max into the plan so that it covered the 60 and everyone else benefited from getting a lower rate for the other plans. Any questions? I just thought it'd be worth having that information so that we could see what has happened historically.
I don't sit on the insurance committee, but I know, I like this. This is a good, nice visual because it makes it easier when you're talking about all these numbers. At this point, what are we talking about for 2027 when it comes to the overall contribution that an employee's, like, difference?
So what has come out of the insurance committee is that depending which plan you have, the 54 is going to go up by about $84 per pay period, up to the 60 is $120 per pay period. So that's what the increase is looking like. This year, we're also exploring self-insurance and going and getting that supportive fleet that is kind of a new thing through the FADS, because it's kind of under the umbrella of the Superintendent's Association, so that all districts are kind of part of it. It's something that's supposed to be just for school districts. The reality is, whether we go fully insured or self-insured, currently, as it stands with what the insurance committee is recommending, there's no actual difference in the cost whether we go self-insured or fully insured. And what board members will have to contemplate and what all our employees will have to think about is that the goal of going self-insured is that will help with transparency, it will help with planning, so that the overall plan saves money, and eventually that will drive down the cost of increases over time and provide better services to our employees. That's the goal of exploring that. Because the disadvantage of always going self-insured is the risk involved in paying your own claims.
I think part of the discussion, even through the process with Fleet, part of what our goal was is to find out, like, presumably to be self-insured, you have to have an investment pot of money set aside. So I think that's the difficult part, is that we, for the last year or so, have been taking steps headed in this direction, because the first meetings with Fleet were last year. And they seem to represent options that people have been asking for, like, why can't school districts join together to, negotiate better rates? Why can't we have employee health clinics? So all of those things are, like, just on the horizon. And I think, the question remains, like, what did we do to prepare for that changeover? Because I think the other part that I want to make sure employees understand is, right now, we don't even know, because we don't have access to all the health data that Blue Cross Blue Shield maintains and collects as a fully insured model. We don't even know how detrimental recommending adjustments to our plans to limit costs right now could be, and how many people that would affect. So we would be going into something like that very blind to say, oh, well, we'll just minimize this, or, like, the attempt to just go for higher deductible plans was not really a palatable one, because it didn't save us enough money to make it worth it. And I just, I think all of those factors in consideration, it's difficult at this point to know that whether we stay fully insured with Blue Cross Blue Shield or we move to this other self-insured model, it's basically the same amount of money.
Yeah, I think it's really going to be important for us to be successful at going self-insured. People are going to have to really understand and believe in the hope that that will provide us savings as a district, and that will eventually translate to something that means something to employees. Because this year, it doesn't help the individual's pocketbook, because it is the same cost regardless of which way we go. But if we get through this year and we start to put a clinic in and we give incentives to our employees to use that clinic, it's going to drive the cost down of our plan, which will mean the plan will cost less for all of us, because everyone's helping this plan work. Employees contribute to it, the district contributes to it, our grants and millage contribute to it for those employees that are funded that way. So all those costs will go down if we can reduce our claims costs, and helping our employees make better health options, not just for themselves and what's best for them, but also for the cost to the district. We kind of almost have to reach a point where it's kind of like the Three Musketeers. We're all in it together, right? And so that will be the goal. And I do think that there's some momentum started in Fleet and in the organizations that have kind of fused to become Fleet, where that has been true for other districts. I think at the board workshop that will happen in September, we'll talk about some of those districts, and some of you who are on the insurance committee have seen like Charlotte County and what they did in 5 years, taking $2 million in reserves up to $22 million, so that is translating into real financial meaning to their employees now. But it is going to be something that takes time to really fully appreciate.
So one thing that we discussed amongst ourselves that needs to come back to the insurance committee, and maybe mentioning it here because we have a broader audience, people are willing to listen to the education part. I've had people asking me, so what can we do to lower the cost to the district so that we don't keep seeing these high costs? Somebody even asked me if it would be better if they changed where their pharmaceuticals are coming from. And I said, that's not really a question I can answer, but thank you for thinking about that. The idea of the huge difference in cost between the emergency room and walk-in clinics. So we need to find a better way to educate people. The health champions at schools is not working. Most people are like, there's a health champion, what? What are you talking about? So we need to find a better way, which is something insurance committee needs to work on.
I do believe that because there's this momentum in Fleet, that some of those things that we've talked about doing and tried to do can actually become a reality.
What happens if we do go like a self-insured and we go over our claims? So costs then would just continue to go up. I don't know anything about, so I'm just looking at the fact that we signed a TSIA for 666 people. That's $77 a paycheck. If they have the most expensive plan, they're going backwards about 50. If we stick with 550, because that's not our proposal, but if we were to go, if that's the proposal that was to go, that's only $23 a paycheck. We're going to see people going back hundreds of dollars. It's quite the sell then to get them to buy into self-insured, I think. But
I think you described an unfortunate but true, very, very clear math reality. I think the only thing that we can focus on is that we have a plan to keep focusing on this. One of the reasons I shared these numbers is that it doesn't help us this year, but we have kept the cost down to the employee all these years. You haven't seen health, increase. Yeah, yeah. So it could be the year that we just have to bite that really terrible bite, right?
Couldn't we bite it when it was like 6% and not 23%? I mean, this isn't a small bite.
No, you're not wrong.
This is chunks, I mean, of people's paychecks. Especially.
Yeah, and I think that's the decision that is going to be the decision to make, is that bite's going to be taken this year, and it's like, do we take that step this year to try to make it better because we'll get the data, we'll start the clinic process, or do we hold off because of the risks? I mean, that's really the essential choice before us.
I'm not following you. Do we take the risk of what?
Of being self-insured, because it always comes with, you have the risk of paying the claims. Dana brought up the point that people's fear of this is that what if our claims are above what we fund the plan at? I mean, we talked about it in the insurance committee, is that we have a little bit of reserves. It's part of the assigned funds that we kind of have designated not to spend this year, because that would be kind of a backup for that thing. And that can make up as much as we talked about at the committee, 15% or more, which raises that confidence level that we talked about ad nauseum as a committee. What is the best confidence level to fund the plan at?
I mean, that might be the concern, but I think people's bigger concern is, what does this do to my
Right, because that's tomorrow's,
pay?
that's tomorrow's
What does this
issue.
do to?
Yep, absolutely.
Well, it is everybody, but it doesn't affect everybody the same way, right? I mean, yes, people who make higher salaries, that nobody wants to go backward, but it doesn't affect everybody the same way. We have people whose families are already living paycheck to paycheck, so going backward by any amount, even if I do get the raise up to $2,000, I could still be going backward $22. You know, that is not something that I think people are willing to just accept. So I think there has to be some way that we think about mitigating that. It's like a cliff. 23% is a huge cliff. So if there's ways that we can think about making some of it a responsibility, like what Dana was just saying, a smaller percentage that gets phased in till we get to a point of that number. Because the reality is, Blue Cross Blue Shield was already making a profit on us at this 64.4% confidence level, or whatever that percentage funding level represents. They were already making a profit on our group. So the benefit of the self-insured is that now that doesn't, it's not a profit for Blue Cross Blue Shield.
Right.
It's something that builds up. So you mentioned Charlotte County and increases in reserves, but like, I know that our members on the insurance committee pointed out again and again, increases in reserves is money that the district gets to hold on to. So what our people want to know is, how does that translate into something that actually benefits them, other than we will not have years where the claims exceed the money available.
Right, and I think it can benefit in two ways, because you can make changes to the plan that impact the employees, like lowering deductibles. If they had higher deductible plans, they brought those down. You can also, when that gets to that certain point in fleet, you can take that money back. So I think there's always options to reinvest that. And then it's also going to ultimately, the goal, like, we were probably wrong, in retrospect, to keep the individual plan at this level for employees all these years, right? Because obviously, we all appreciated it, right? Because there was no increase, but there should be some moderate increase. And so the goal is to keep that moderate increase going rather than these, 23%. So-
But the plan did get an increase. Like, I don't understand that point. The plan increased every single year. It may not have been an increase to the employee, but it's not that we staved off any increase. The board was paying increases year over year.
Right, but see
So-
now, that 8 million, I approximated 8 million, is now something that we gotta stick in the budget every year, So if we had done that differently, we might have that 8 million to do something else. You see what I'm saying? So. So part of what I anticipated was that maybe you guys, because of your role in the insurance committee and your knowledge of these things going on and us working on these things, I anticipated you guys might have come with something that wrapped maybe a former request with what you thought was best for salary versus health insurance and having some sort of vision of what you thought your members would want.
Like, do you mean bargaining for a bigger raise or covering insurance? Is that what you're saying?
Right.
I mean, we've talked about that. I feel like we have to survey.
Right.
That sense, because insurance committee was last Wednesday. And, by the time we talked, it was probably Friday, and then, I don't know about you guys, wasn't very live this weekend.
Right.
I didn't feel very good about that. But, so I do think that would have to be our next step when it comes to that, because we also have to think about the fact that we have people who don't take the insurance, right? And if they're sitting in that, I mean, that's just a group of people in itself. I don't even know how many people take it versus don't take it. But we did talk about having to probably talk to members, because it's just, right now, it's just been a quick, I think we booked this meeting with high anticipation, and then it's just been a very quick turnaround, and that information
Yep.
is a lot to digest, a lot to take in, and, yeah.
Well, I also think that, we were anticipating coming back to this meeting with a response to what we feel was a more in the ballpark, reasonable, offer and range of raise. So if I have to survey people based on the $550 the district is offering, I just feel like I'm going to make them angry. Truly. I'm going to put out a survey, and it's literally going to just incite anger, because when you know what this looks like and they're being offered $550 as their raise for the year, for the people that I've already spoken with at a few different sites over the last week or so, since the initial, the first meeting where it was presented to our insurance representatives that the increase was looking at 23% either way. I mean, there have been people that are like, I won't be able to afford to continue working here. I'm going to look to work somewhere else because of not being offered enough of a raise and having to come up with more out of pocket for insurance. And I mean, we can certainly survey based on what the district has offered, but it is going to, yeah, it's just going to make people angry. So that's why we were coming back, hoping that there was more conversation on the side of what, if we are looking at these increases not being covered by the board, or if we are looking at somehow having to come up with a middle ground of what the raise could look like and what insurance can look like. I mean, we put everything into our first proposal, including TSIA.
Right.
You put everything in the response back. But I guess that's what I'm saying is, if that's the story you want me to tell, and you want me to tell people that the board is only offering $550 to more than 1,000 people in our unit, and they're going to have to eat the insurance, I just think, well, I can do that.
Well, and I think that I want to modify that to say, based on the offer, the budget line item, and the TSIA, that's where we're at. We're still, I mean, the other reality is we discussed how that was a rush timeline. We're still building the budget for September. We're still, doing 10-day count.
Yeah.
So I think we're looking for a little bit more data too, to keep assessing what is possible. But certainly when we spoke in July, that's what we knew we could do. And so I think
Right.
part of it is that we may be very happy we have a meeting scheduled for September 14th, and we'll talk then. Since we are here, I wanted to just give you an update that after 5 days or 6 days, it's, we're 280 below. We're 280 students down. So that's where we are. Okay. So we'll have more conversations, and we'll certainly be able to say more on September 14th, I hope, so that's our goal. From projections.
282.
Do you want to add anything to that, Alexis?
So during the 10-day count, it's kind of hard to pinpoint the exact, so we have what was projected, we have currently enrolled, we have consecutive absences, which used to be the no-shows, and then we have a true, these are butts and seats. So our projected was 22,367, and after all the consecutive absences are backed out, and it's 22,085. But again, we still have days left. We still have people actively enrolling, so hopefully they'll continue to improve. I mean, last year, I think when I looked at it, the very first day of 10-day count, we were down something like 1,480 students. This year, we started at like 1,080. So there's still time to improve, but we won't know till we get to that point, and we won't truly know until we get to probably right before that next September meeting, because that's when we start running prelim reports for class size. So,
Like we always say about that Labor Day, too.
yeah.
Yeah.
If they're coming from up north, exactly, yes,
That is
yes.
still a phenomenon. There's still people
That don't
surprised
realize that
we're-
they're supposed to be in school right now.
Yeah.
So that's a possibility.
We do a 30-day count? No, I'm just-
Actually, last year we did
did. We
extend
did the
it.
second one right after
Yes.
Labor Day.
And I think we might have even done it the year before. It might have been because of a storm or something. I remember there's been a couple times where we tacked on 2 days, 4 days, an extra week,
Yeah.
just to keep watching it.
It looks like about 100, well, families representing about 100 students didn't realize we had a 4-day week last week.
Right.
One question I have about right now we have 2,200 people taking the insurance. When this becomes unaffordable and people leave the plan, what kind of impact will that have on the plans themselves and on, that whole process of being self-insured, because what if we're only bringing 1,200 people
Right. It all
into
de-
fleet?
And everything will, it's very hard to predict that because for everyone that leaves, that's that much less funding going to the plan. But for everyone that leaves, there's that much less people putting claims in on the plan. So it could be, as far as the health of the plan, it could go either way, depending on, it depends on who leaves.
I mean, do we really have to speculate on who leaves?
Right, but even that.
I mean, some people cannot leave, right?
Right. And-
But there will be people that are like, I never use this anyway. So, and those are the people helping fund the plan and not having lots of claims. I mean, that's the reality that,
But I think the reason insurance is a gamble, because the people that leave could have been our high claims people. You don't know that until the year happens. It could be either way. I mean, I think we all have this idea that we know who costs us more, but I don't know if that's reality.
Right, because if it's like a
Okay.
catastrophic incident and that person wasn't anticipating that happen and they were one of those low claims people, that could have been the ones that bump it up, because it's not always the people that take the highest plan and utilize it the most. It could be that one-off catastrophic incident that drives that pool up. So it is always a gamble, but I understand what you're saying. The more you have in the pool that don't utilize it, yes, but there have been plenty of incidences, I'm sure we all know of some, where it just came out of the blue,
Yeah.
and those are extremely high rates.
what about if people decide to leave certain plans and gravitate only toward the least expensive plan?
Well, I think-
What effect would that
I
have?
mean, one thing is that even the least expensive plan is still funding, and if they're people that do that because it costs less and they're not using it, it works out okay, because they're putting in less, but they're expecting less because they have deductibles to pay before, they might have more of those things.
Can I just ask a question about the millage chart that was shared?
We, you're welcome to, we are gonna, the next millage meeting is October 6th. We'll definitely have more understanding then. But
Okay.
if it's a simple question, we could get out of the way.
Well, I mean, it's a significant difference in the carry forward this year, right, coming into this year. And if I
Compared
understand
to-
the report, the way that the carry forward is reported is those specific amounts are reserved or held for the purposes listed on the line next to it. So that's how it worked last year when the carry forward was 6 million. There were designated things that it was intended for
Yep,
that weren't accomplished in the previous year.
yep.
So that's the same in the report that was just shared.
Yes,
Is the question.
yes.
Okay. So at what point, I mean, the millage committee, it reports out for transparency purposes.
Absolutely.
But what drives the decisions of what goes on the list for millage? Because it's not the committee.
Matt, I can help answer that question if you.
Sure.
So I don't know if you remember last year when we were going through all the carry forward list, and I said, not just for millage, we were going to evaluate all those carry forward funds and the need of what's really being carried forward. And one of the things for millage is halfway through the year, we took a look at, are these positions being filled? If they're not being filled, then we're going to go to step 2 or plan 2. Like superintendent has his goals and missions on what he wants to spend the money on as far as for those different pots. It's whatever the goal is, I guess, at that time. And for example, if you remember, we weren't able to fill, I want to say, athletic trainers. So that money for those trainers, it was repurposed for an outside, it's an outside agency basically to fill that. So we took that a step further. So come year end, we weren't saying, oh, well, we weren't able to fill all these positions. We were still utilizing the money for the purpose and the intent on what we had it for. It's just why actually have that sitting there for positions that we could not fill, but we still needed the job to be done, so that's why we contracted out. So we've been evaluating that more frequently, not only with the millage funds, but also with those other carryover funds that we, year after year. I'm just trying to go back, if you remember, we talked about that, because that was, it is misleading. Why you have, you say you have nothing, but then, you come to year end and you have all this carry forward. There is some that, of course, we can't do that with, state categorical funds, we can't do some of those things with, but as you see, we're dwindling those lists down, so the funds are being properly spent when they need to be spent.
There are still several lines listed that say additional duty, but there's no longer a descriptor next to it. So last year it said additional duty athletic director, additional duty, and there were specific positions. And now it's just 3 lines that say additional duty.
So what this year for additional duty, as we did last year, is there was not budget for additional duty in general. Additional duty, the bulk of it regardless is what was for ESY, athletic trainers, in the summer, other programs that happen. So the additional duty is in the same bucket as it was for the continuation of programs, and it's utilized for that, for, athletics, additional duty, for ESY and other things like that. So there is no general fund budget this year at all, as there wasn't last year for additional duty.
So how was ESY funded before it showed up on the millage list? Because that was new for me.
So
ESY, I thought, was always funded.
You're right. You're right. So I'm just going to go back to our original conversations. The budget process was a lot different 2 years ago. There was budget, okay, this is an additional duty budget. Not saying that was right or wrong, but through this process of going and transitioning into this position, we've actually defined more areas, and that's the goal. But you can't do that in one day. You can't do that in just you can't do that in a few months, because there's so many things going on. So yes, additional duty or ESY was covered before in the past. However, when we had the ESSER funds, ESY grew really big, and we were accustomed to those really good services from the funding. However, that funding went away. And as that funding went away, went back to the general fund. So that's why we're trying to scope, pull that back a little bit more and go back to what we really are required to do and what we have to do. That was our resource.
Well, I think that in order for the community and all stakeholders to really understand the crucial point that the district budget is at, there does have to be there has to be a lot more of that kind of communication about some of those services are not going to look the same. They cannot, because we can't afford to do the same things because of the way that we're funded right now. But if we continue to pretend everything's okay, and we're all holding it together with duct tape and glue, it's never going to result in the change that our district needs to increase funding from the state level. So until parents and community and all the stakeholders understand that, yes, that is a perfect use of something like millage, it's taxpayer voted, so there isn't anything inappropriate in that. But my point is, we are supplanting at this moment federal funds that used to be coming into the district through ESSER, and that ended. So now we're okay, well, we can keep doing this, but we can use this other funding. But it is we're going to get to a point where we won't have teachers in classrooms. We won't have bus drivers. This health insurance picture is going to be so devastating to employment in the district that we won't be able to continue to dress it up like we can keep going as status quo. So I just want to ask again, I know that one of our sessions last year, there was a lot of discussion about how many positions, mostly not in our unit, but how many positions can be costed to capital so that it frees up general fund. And that has been a practice that we didn't want to do. That's what I understood. We didn't want to do that because if you don't code it correctly, if you don't do all of the reporting correctly, it results in audit findings. But we're at that point where there has to be more general funds freed up.
We've done that this year. We did not apply, we actually are using the maximum allowable amount this year. You'll see that in the final hearing. The funds were directed as they could be for statutory guidelines. I know that there was the transportation and such, but rather than go through that process for job descriptions, which would be required because time and effort logs and all that would have to be done, we shifted a lot of the maintenance cost into that transfer, which freed up general fund dollars for something. So regardless if it's salaries or whatever, we are maximizing the amount of money that we can transfer from capital into general fund. So we did do that. I did want to say too, also this year when we distributed the budget with the support of the superintendent and the school board, you know, we 100% went through every budget line item for departmental wise as far as if it's an essential thing, if it's something that we like, but it wasn't, you know, we're not sure if we have to have it, those things. We went through every single line and just kind of, you know, let's cut this back, let's cut this back. But the most important thing is we did not want to cut back services for student instruction or for safety. We did cut back things that wasn't making everyone happy. You know, we had to do that in order to balance the budget and still try to maintain that quality education that we can do without, I mean, it was majority at district level. Honestly, I'm not part of the allocation process, so I can't speak to that, but I know from the departmental wise, we did a huge amount of cut. We met at least 4 or 5 different times at the cabinet level, and again, nothing is getting, all overtime is being looked at, all additional duties being looked at, nothing is rubber stamped from this point forward. You know, everything's being looked at. And again, the main goal was student instruction to not, you know, have that suffer or any safety issues. Other things that were just wants and not needs, you know, at a department level, they were cut.
I mean, I do think that I just had somebody ask me this question today regarding, you know, purchases of new programs and some of that stuff that's happened, because that's still happening. So, you know, when we're in a situation where teachers don't even have enough laptops and devices to run some of the new things, to properly utilize them in classrooms, I think that has to be a consideration of, is that a now expenditure? Is that something we prioritize right now? Because we all knew the devices were gonna get broken and, you know, they need to be repaired and they need to be replaced, and that was always going to be a constant battle to keep all of that refreshed and, you know, to be able to put together classroom sets that you could actually use. It's a great goal, but like with the financial condition of the district to purchase new software, new programs to use, when we don't have the devices and we're not in a position to refurbish and replace devices, it doesn't make any sense. So I do think that some of those considerations need to be a little bit more like scaled back. And just because I asked at a previous session about like the cuts that happened here position-wise, I know that there were some clerical that, but when I go through the professional technical reappointments, there's very few. There's 1 or 2 in each level, and I don't think that mirrors what school sites are seeing.
What do you mean by what school sites are seeing?
Well, school sites that have already through the allocations process had like, okay, you're losing 2, okay, we're gonna we have to hold
nobody's
that.
lost more than like one or two, so that's what I'm trying to gather. What do you mean by
But the
proportional?
difference in cost of a position in the professional technical
It's not that
realm,
different from a
the
teacher.
difference in cost to a school site.
It's not that different.
Right, but this is one, and every school site we have up to 23, 24.
And the ones that they lost at a school site would have been because of class size.
Which right now we're still monitoring.
Right.
But I guess what I'm saying is I understand that lots of work has gone into minimizing and cutting budgets on paper, but ultimately it's the same thing that I've said going back a year or two. While we've experienced this expansion of more departments working out of this building and more people in those departments, you have competing needs and competing interests for how we spend money. So that is a reality. And if we're going to get back to a situation where we don't have as much competition for the limited resources, I think that's what has to be looked at.
And we've even looked at like director and administrator level. So as they vacated or somebody has retired, we're not filling them, and we're trying to like actually cross-reference and have like dual support between departments. So basically doing more with less, which is exactly what's happening at some of the schools. So it is happening. Since those reappointment lists, we've had additional directors, PTS leave that have vacated that we haven't filled. So what we had said from the very beginning was that we wanted to preserve people. And we were most definitely looking at vacancies first.
Right, but some of those people also carry certifications and could have been filling roles
Which is
elsewhere.
what we did. Yeah.
So that is the part that I don't think has been very transparent about the ways that the district is working really hard to save money. That's not what our people are feeling. They're feeling like there's still a person in every office in this building.
Well, it's not the case.
Not the case.
Are they looking for specific names? Because,
I don't have specific names, no.
I mean,
No, I mean, we're talking decades ago now, but a lot of these offices used to be book storage.
and a lot of them are also itinerant. So where you used to have an ESOL person at every single school, that's no longer the case. Where you used to have a media specialist at every single school, that's no longer the case. So they may have a home base here, but they do not report here every day for work. They are sent out to the schools. So I
Yeah,
feel
I
like,
don't
are
know
we
that
speaking
many-
about
I don't
a
know that many of
specific?
them have, consider this. I don't know that many of those positions, maybe media specialists, but the ESOL leads, I don't think they consider this a home base. I think their schools are there.
Right, so that's what I'm trying to think of. Specifically, what are we looking at?
I just think it's,
I think it
it's
is a
an
percep-
over, it's
It's a
100%
that's what I'm
a
saying,
perception.
yes.
It's an overwhelming feeling
Yeah.
that our unit, because that's who we represent, our unit is the one that feels a lot of the brunt of these cuts. And yet, there isn't any release or relief of the things that have made this job so difficult in the first place. Valuing our time, making sure that we're not doing extra paperwork tasks that, take up people's time, or, hey, we just changed the platform again this year, so learn it all over again. Those kinds of things are what is also adding to the stress and the feeling that people want to look at what's happening elsewhere because they don't feel like they're being prioritized, heard, attended to, like their concerns are being attended to when it comes to the priorities and how the district is prioritizing their spending. those are the questions that I'm fielding all the time. Some of them I send, I share, but those are the questions that are coming at me. And, when I have firsthand experience about something, I will reach out directly and ask about it. So
And
I
people
don't.
are more than welcome to reach out, because I would be happy to clarify, because I do think it's important that we have the correct perception out there of what in fact is happening.
Okay. Anybody else have any other questions?
Just staffing specialists. I don't understand there were 3 or 4 vacancies that were not planning to be filled.
Okay.
Staffing specialists, last I had heard there was 3 or 4 vacancies that were not planning to be filled. Do we know how those schools are going to?
Are you talking about the ESSER positions? Because if they were part of the ESSER rollback, other than that,
I don't believe so.
and what schools were they attached to?
So I don't know exactly what schools. I just know across the district, we had 3 to 4 staffing specialist spots that were not, at this point, being hired for.
I'm not aware of anything that wasn't ESSER allocated. Go ahead.
So both of our schools do not have a current staffing specialist, and we've been told that they are interviewing right now currently to
Right.
help fulfill that.
That's why I was confused.
Till then, we're getting supported by district personnel to run our staffing, ESE staffings.
I think that was important that you mentioned about the ESSER positions, because there were many of those ESSER positions that provided support at the schools, that were helping the teachers with many things. And that money is gone, so those positions went away. And that is where I think a lot of people feel it, because those were the positions that helped us at the school level feel supported. I know the schools that did not retain their MTSS positions, and it feels like there's a lot of work that's going to be going back to teachers. I understand it was ESSER funded, which is why it went away, but those are some of those spots that feel the most heavy.
And we'll have to keep an eye, because I fear that there's a possibility that some of the federal funded positions that support our schools could also be in jeopardy. But that's not, what's that?
Just being transparent.
But I guess I just say that because it's one of those things that we don't have direct control over. So we have a planned meeting again for September 14th. Same time? Same bat channel? Okay.
Is there anything specific you want to make sure we include in the survey?
First of all, I just want to be clear, I don't want you to, I'm not directing a survey.
No, I understand, but we do feel,
Yeah,
it was just between Wednesday and Monday, there was no way for us to put something out that would have given us a way, to know what to
Right.
do today. It doesn't give us enough time to get enough responses.
Yeah, absolutely. I mean, I think it would be helpful if you knew what was more important. Straight salary, is insurance really important? That kind of stuff. Does that make sense? Okay.
Yeah, we got that part. I just wondered if there was, something else that, we needed to, because.
Yeah, like something else to think about that we weren't thinking about,
Yeah, I'm telling you right now, if I put the survey out with the current information available, it's,
And I fully
yeah.
appreciate that, because there's not an exciting time to be sitting at this table, right? We wish that
Rough.
we had much better options to be talking about.
Well, we have excellent schools that everybody should be bringing their kids to,
Absolutely.
so.
And we-
That we know.
And administrators are all calling all those, what are they called now, consecutive absences? We're calling them all up, trust me.
So are some of them just like, oh, you're waiting on me? Okay, I'll be
Yeah,
right there.
that's
Okay,
exactly what's
let's
happening.
go.
One. I just need it to be known that the calendar gets posted on the district website in February. I'm just letting everyone know. It's already written for next year? I honestly, I probably should for teachers too. I get the text, it's Christmas break. It's on the calendar.
Okay, September 14th at 5:15 is what I have.
Yes. And we, just for the good of the group, we have another one planned for September 28th.
Yes.
Yep, okay. Thank you
Okay.
guys very much.
Thank you.
Appreciate your time.